there's this argument, and it's called the drowning child argument. And it goes like this. Imagine you're walking alongside a river, and you look to your left, and you see a child drown. Would you save this child? Well, of course you would. It's a child, and it's drowning right in front of you. But would you still save this child knowing that it would ruin your clothes, and it would ruin your phone? Well, of course you would. It's a child, it's drowning, it's worth more, it's invaluable, the life of a child. So then the argument goes like this. If you'd save a child that's drowning right in front of you for a little amount, that's the cost of your clothes and the cost of your phone, then why not donate some money to some charity that saves life in a poor country somewhere, for example in Africa? Because what's really the difference between these two situations? We have situation A, where you save a drowning child that's right in front of you for a little amount. And you have situation B, where you save a child from some disease in some poor country for a little amount. And the argument says, well, the only real difference, right, is spatial distance. And spatial distance is not morally relevant, right? And this argument is great, but it also got me thinking, what if it's not you that's standing next to the river? What if you're a very wealthy businessman? And you're a very wealthy businessman, so you're wearing a suit that's worth about $2,000. And you're wearing a watch that's worth another $1,000. You're walking alongside a river, and you look to your left, and you see a child drown. Should he save this child? And I wasn't sure. If you want to help as many people as possible, it might be better to keep on walking, go to the nearest store, sell your suit, sell your watch, donate all of this money to some charity who saves maybe 10 lives with that money. But that's an appalling conclusion. That's a conclusion you don't want to draw. But I had this idea in my head, and I really wanted to know, actually. I want to know, for how much can you save a life? Because a life is, of course, invaluable, but we can certainly talk about for how much can you save a life. So I went on a mission to find out where to save a life for as little as possible. But the world's vast, so I had to narrow my search down a bit. So I thought to myself, well, where in this world can I save a life for the cheapest? And I figured, well, it's probably in some poor country somewhere, right? Because in poor countries, people die from diseases that don't even exist in first world countries anymore, because they're so easily and cheaply cured. So I figured, all right, I have to focus on charities that save lives in poor countries. I really narrowed it down. But then I thought to myself, well, I've heard that all charity pretty much wastes money anyway, right? Isn't the for-profit sector maybe the better sector to look? And global capitalism has raised millions of people out of poverty. But I think the 10% most disadvantaged, there will always be a role to play for charity. Because you can't monetize the 10% most disadvantaged. How do you monetize a poor child that's dying from malaria? And should you? So all right, in theory I thought, well, charity should be the place to look. In theory. But in practice, how effective is charity really? That's what I wanted to know. So I went online and I looked for research on the effectiveness of charities. And I could find very little. But finally, I found a study by Evidence-Based Policy. And the study had two conclusions. The first one was 75% of all social programs and services have no impact at all. Some are harmful. So it means that they're actually accomplishing the opposite of what they're trying to do. And 75%, that's such a large number. That really shocked me. And I really want to know, why is that? Well, the second conclusion of this study was the vast majority of social programs have not yet been rigorously evaluated. And I thought to myself, okay, so if these nonprofits aren't held accountable, if there's no metric to track your progress with, then there's also no incentive to actually produce results. And when I went online, I also saw this pattern of, when I went online to look for charities that save lives in poor countries, I also saw this pattern of charities not actually telling me what the results are, like how many lives they're actually saving with how much money. They told me about what they do and how they do it, but they didn't really tell me their results. And their metric for how well they did was this metric called overhead. And overhead is just a blanket term for administration costs and fundraising costs and marketing costs. And they'd boast about how their overhead is so very low. But I didn't understand, why is that relevant? Why do you want to have low overhead? Imagine an ailing business boasting to its investors, well, at least our marketing costs are low. I think the investors would say, well, better invest some money into marketing because you're producing no results. Or imagine a hospital saying this: 99% of our funds go directly to the patients. We don't pay high salaries to attract the best doctors, and we certainly don't have an administration system to keep track of our patients. I don't really care about overhead. If you have a really big problem and you need to raise a lot of funds to solve this problem, then that's fine by me. If you need to pay high salaries to attract the best doctors to save the most lives, that's fine by me. I want to know, what's the impact per dollar? When I give $1,000, how many lives do we save with that money? That's what I care about. That's what I want to know. But they wouldn't tell me. But then I thought to myself, I need to define a life better in this search. And apparently in public health, they use this thing called a quality-adjusted life year. And it's not only a metric for how much an intervention extends lives, but also for how healthy a person is during that extension. And apparently 30 quality-adjusted life years equals a life saved. And I figured, all right, that seems reasonable. I care more about maybe the happiness also during that extension, but a quality-adjusted life year, I can live with that. And of course, you don't want to choose between interventions. You want to help everybody. But our resources are finite, so we're going to have to choose anyway. And then we might as well choose something that maximizes something like the quality-adjusted life years. It's a decent metric otherwise. So I finally knew what I was looking for. I wanted to know how many quality-adjusted life years do I get per dollar. I want to find a charity that maximizes this value. But I couldn't find it because they wouldn't tell me. So in like a last desperate attempt, I just Googled this: a charity that maximizes quality adjustable life years per dollar spent. And the very first hit I got was from a charity called Giving What We Can. And I pressed on the page, and I really didn't expect anything. But I got quite happy because their mission statement was this. Giving What We Can's mission is to recommend charities to donate to using evidence, data, and rigorous reason. And I was like, wow, these are my people, they understand it. And when I looked around on their website, they also had this blog post about how overhead is kind of a silly metric. And I was like, yes, these people, they get it. You care about the results, not exactly how you get there. I mean, it's nice to know, but what are the results? And one of their top charities is called the Against Malaria Foundation. And the Against Malaria Foundation hands out insecticide-treated bed nets to poor villages in Africa. This is apparently one of the most well-researched interventions out there. And GiveWell, an independent researcher of other nonprofits, estimates that the Against Malaria Foundation saves a life for $3,000. But that made me happy actually, because, well, that means our businessman can just go jump into the water and save the child, right? Because his suit was worth $2,000, and his watch was worth another $1,000. 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 And h But then I realized, wow, it took me hours to find the Against Malaria Foundation. It took me hours to find a charity that tells me exactly how much good they do with how much money. And if it took me hours, then it will probably take other people hours as well. So what if you are a charity that raises funds for these effective charities? Then you can multiply your impact. And apparently Giving What We Can is exactly such a charity. I didn't realize it at first. So Giving What We Can is a charity that does research, but they also raise funds for these effective charities. And when you give them $1, they'll get about $6 from other people that otherwise would have not donated to charity, and especially not to effective charities. But what does this mean? This means if I give about $500 to Giving What We Can, they'll make sure that $3,000 will go to the Against Malaria Foundation. And that equates saving a life. But that means that maybe, just maybe, when that businessman sees a child drown, it's better for him to keep on walking, go to the nearest store, sell his suit, sell his watch, and give all of that money to an organization like Giving What We Can. And that upset me. I wasn't very happy about that. I want to live in a world where there's no moral justification imaginable for not saving a child that's drowning right in front of you. I want to live in a world where an opportunity like Giving What We Can doesn't exist because all of our charities are effective, because we thought about the effectiveness of our charities, because we thought more critically about how we rate our charities. So let's together make saving a life more expensive. Thank you.